Ministry of Health's Non-Communicable Disease Control Unit, in partnership with the Gambia Police Force, Gambia Revenue Authority, and the National Environment Agency, today held a joint press briefing at the Central Medical Store in Kotu. The briefing is focused on recent enforcement of the Tobacco Control and Regulation Acts aimed to curb tobacco use across the Gambia. The head of the Tobacco Enforcement Unit, Pabo Young, states that there will be no room for compromise regarding the prohibited products.
Anything that is prohibited is totally banned. There is no room for compromise on that particular product. The law bans it totally. We can negotiate on control issues, the way you handle it, the way you use it, and how you distribute it. But prohibited products, there is no room for it. I think we have to make it clear. We cannot keep on going to places, seeing such products in circulations and try to compromise with you. I think it's high time for us to test the water, the legal side of it.
The joint enforcement exercise marks a significant step in efforts to reduce tobacco-related illnesses, which remain a leading cause of non-communicable disease in the country. Tobacco use contributes to heart disease, cancer, and respiratory conditions, putting a heavy burden on public health systems. What are the statistics? Here is Aziza Amina Sahid, Health Promotion and Risk Communication Officer, World Health Organization.
Over 146,000 deaths are occurred in our African region every year with tobacco factors. And also, today, more than 61 million people in the African region are using tobacco, especially concerning the increasing prevalence of use among our adolescents, who are the vulnerable ones in the society. And this call for a robust action from our community stakeholders.
Statistics show that the country has over 400,000 smokers, amounting to 16.7% of the Gambian population. Michael Manga Mendy, the Director of Health Promotions and Chairperson for National Tobacco Control Committee, also highlighted the alarming statistics of the use of tobacco globally and urges the public to be on the front line to curb tobacco consumption.
We encourage everybody to take part in this, being in the front line or wherever you are, and recognize that we all have our roles to play in this so that we will live in a very healthy nation. When you look at the tobacco use that we're talking about, we have been seeing records, and records have revealed to us that globally, every year we lost over 8 million lives. And when you look at these 8 million lives that we lost every year, 80% of them are from where we live, part of the world we live in.
The enforcement actions have targeted illegal tobacco sales and strengthened compliance with regulations, including restrictions on advertising and sales to minors. Authorities have also intensified border controls in other key regions.
From now on, we will have a very robust approach on this e-cigarette, because it seems as it is taking a drastic way of importing this product in the country. Now, even these corner shops are having this e-cigarette. We're going to make a stop to it, and we will start it with immediate effect. By next week, we'll be in URR and CRR areas. Maybe 1 or 2 months, we'll embark on this operation again.
Since the implementation of these regulations, early reports indicate a noticeable decline in illicit tobacco trade in key areas, although officials acknowledge that sustained efforts and public education remain critical to long-term success. This collaborative approach between health and law enforcement agencies is expected to continue, reinforcing commitment to healthier communities. Reporting for N24 News, I am Basiruka.